Okay,
Take
take one.
We are ready.
Okay,
We're live.
atria. Okay, thick wall here. Right away, looking at it, we know we have the right side, the left side. Take two. Left side. So this is our right atrium, right ventricle. Between our right atrium and our right ventricle is our tricuspid valve. Left atrium, left ventricle. Between these is our bicuspid or mitral valve. When the right ventricle pumps, it's going to push against this valve and it's going to push blood out through this artery, your pulmonary trunk and your pulmonary arteries. But notice they're blue because they're deoxygenated. We're going to the lungs to get oxygen, but it's still an artery heading away from the heart. Since this is pulmonary, this is the pulmonary semilunar valve. So we go right atrium, right ventricle, pulmonary trunk and arteries, we go to lungs. When we come back from the lungs, we're going to be oxygenated. We're going to be coming back through way of veins, but they're red oxygenated veins. We come back to the left side of the heart. Go into the left atrium, through the valve, left ventricle. When this thick-walled left ventricle contracts, we're going to go through the aortic semilunar valve. We're going to go out the aorta. From these, we're going to feed the head and the arms. This is brachiocephalic artery. This is going to branch to be our right subclavian artery for the arm, our right common carotid artery for the brain. This is branched already. This is going to be our left common carotid artery up to the brain, and this is going to go over to our left subclavian artery for the arm. We're going to continue now. This is the ascending aorta, arch aorta, descending aorta. Descending aorta becomes the thoracic aorta if it's above the diaphragm in the thoracic cavity. Once we go below the diaphragm, we're in the abdominal region. We call it the abdominal aorta. That's going to feed the whole blood, good oxygenated blood, to the whole lower part of the body. Okay? Once we go out to the body and we get all of the diffuse our gases and we give all of the oxygen to tissues, we need to come back to the heart. That's systemic circulation. When we come back to the heart from the upper part of the body, the arms and the head, we're going to come in through the superior vena cava, deoxygenated veins. We're going to come in from the bottom of the body through our inferior vena cava, deoxygenated blood, because we're now coming to the right side to go to lungs. From around the heart itself, we're going to bring the blood that's been used up around the heart in through the coronary sinus into the right atrium. Okay? Not everything, but
Nice.